Hi guys. Hello. Hey, I wanted to do a quick review for the medical FISDAP exam on some of the infectious diseases that we covered in the lecture. This was covered in medical overview. So first thing we'll talk about is meningitis. So meningitis is an infection of the meninges. And you can see in this picture, remember the meninges is the dura, arachnoid, and pia mater. Those are the three linings that cover the brain. So they're between the brain right here. This is actually the brain tissue, and this is the skull. So we have our arachnoid, our pia, which is closer, the pia mater is closest to the brain, arachnoid, our dura mater, which translates to tough mother, and then we have the skull. And when you have an infection in these meninges, you can be really sick, and that's meningitis. So PPE that we use for meningitis is a HEPA mask and gloves. Now, I do think it's best to use a gown, eye protection, a HEPA mask, and gloves, but minimum is a HEPA mask and gloves. Symptoms is a headache. Obviously, you've got this infection around the brain, so you've got a headache. A stiff neck. The medical term for stiff neck is nuchal rigidity. Nuchal is neck and rigidity is stiff, so stiff neck. If you have a patient and you try to flex their chin to their chest, they probably won't let you. And if they do, they'll say there's a lot of pain. They have a stiff neck. That's one of the hallmarks of meningitis. They also have a fever. They can have aches and pains, seizures, and as it progresses, you can see this is the petechiae purpura rash. Initially, the rash is petechiae, like little pinpoint red dots, and once those blood vessels and capillary rupture more in a group, you have this. It's called purpura. So they have a red or a purple rash. Also, usually some phonophobia, so they have some sensitivity to light and noise. So if you're transporting them, they would like dim lights and not a lot of noise. The pathogen that infects these meninges can either be a bacteria or a virus. Viral meningitis, sometimes lay people call it like a walking meningitis, but it's definitely a milder version. Bacterial meningitis is really serious. Lots of people, it has a very high morbidity and mortality rate. So people die from this, or if they survive, with some issues, so they don't come out the same. A lot of times people are on very heavy epinephrine or pressors in the hospital that cause vasoconstriction to keep their blood vessels up, but they end up having to have amputations of their hands and their feet. So this is really serious, very dangerous bacterial meningitis. And the population that we look at for these patients is college dorms. It's most common, and it should be your word association. If you hear meningitis, you should think college dorms. And places with dense populations like prisons or inner cities. So that's our overview of meningitis. Next, here we have pneumonia. So pneumonia is an infection in the lungs. Normally, you just don't wake up one day and have pneumonia. Normally, you start out having upper respiratory infection or cold. So you have runny nose, difficulty breathing, shortness of breath, coughing. But once the infection gets into the alveoli, that's when you have pneumonia. So you can see here's normal alveoli. You see your blood vessels running next to the alveoli. We've got our venous where it's dropping off the carbon dioxide and picking up the oxygen. So here is our alveoli with pneumonia. So there's pus in here, just this mucus, and so it's affecting the exchange of oxygen and carbon dioxide in the lungs. So our patients in that area of the lung can have hypoxia. You can hear abnormal lung sounds. So when we go into our symptoms, abnormal lung sounds. Rouse is crackles. It's usually fluid in the lungs, but this mucus is like fluid in the lungs. So you'll hear rouse, rhonchi, and wheezing. Those are really the noises from air passing through narrowed narrow tunnels. So mostly bronchi, you hear because in those bronchioles is mucus, so it's like a snoring noise. And then wheezing is in those bronchioles that they're narrowed from the inflammation and infection. Patients with pneumonia have a productive cough. Usually it's not clear, so they're coughing up mucus and it's usually discolored, like brownish or greenish or yellow. They have a fever and difficulty breathing. And the population that we look at for this is the elderly, nursing homes. If you hear nursing home, you should probably be thinking pneumonia. The young and the old, those with chronic medical conditions, and COPD. And next we've got tuberculosis. So tuberculosis is an infection also in the lungs. The PPE is an N95 and eye protection gown is best, but minimum N95 and gloves. Symptoms of tuberculosis, we've got a cough with pink or blood-tinged sputum, weight loss, night sweats, and syncope. Population, homeless is what you should word associate with homeless and tuberculosis, but anyone in densely populated areas, predominantly in individuals without access to health care or the ability to be compliant with medication. So the homeless already have medical problems. They aren't, they probably don't have excellent nutrition. They don't always have good shelter, so they have issues with exposure. And then their weakened immune system will let them contract tuberculosis. And they don't always have the ability to be compliant. So they could be given a prescription and they could get it filled for medication to treat the tuberculosis, but let's say it's in their bags and their bags get stolen or lost. So that's why the homeless are most associated with tuberculosis, but also prison areas and areas that are densely populated. So symptoms we've got in this diagram: fatigue, appetite loss. This is where the weight loss comes in. Chest pain, weakness, night sweats, just a very classic symptom. Fever, and then coughing up blood. So it could either be frank blood or chunks of blood clots, or just sputum that has some tinged blood in it, so pink sputum. And the last one I'm going to cover in this video is influenza. So influenza is caused by a virus. Symptoms can be fever, chills, respiratory symptoms, vomiting and diarrhea, headache, and muscle aches. So patients with influenza, just wanted to remind you that they can have a lot of fluid loss. People think that, oh, influenza, people get it and then they get better and you stay home sick. But influenza can actually cause profound vomiting and diarrhea. And when you have patients with heavy vomiting and diarrhea, you can have hypovolemic shock associated with influenza. Most people, especially if they have a fever, will have some tachycardia, so maybe you can see heart rate in the 100, 110 rate, and maybe a little hypotension, like a systolic blood pressure in the 90s. And the treatment for that would be oral rehydration, so they should be drinking Gatorade or water, Tylenol to bring their fever down. But if they're having a lot of vomiting and diarrhea and a lot of fluid loss, then they need treatment with an IV, so they need to be transported to a hospital. Okay, that's all I have for reviewing infectious disease. I'll see everybody later.